Third, for patients who have more advanced disease, patients who aren't in the lowest risk category, yet want to be aggressive, another option is to do a combination of both. We'll do 5 weeks of external beam radiation, where we'll use the fancy radiation, intensity modulated radiation, and try and sculpt the dose around the prostate as close as possible. And then we'll do the implant 1 to 6 weeks later in the hospital. Now, both of those things are at a reduced dosage, but when you combine them together, it's higher than anything we could do, either with seeds alone or with intensity modulated radiation therapy. The old way of radiation was like shining a flashlight onto a round sphere. Now with intensity modulated radiation therapy, it's like shining a flashlight onto a donut and leaving the dark spot in the hole. It not only takes into account the shape of the prostate, but also the density of the different tissues that it has to enter and exit in treating your prostate. We have multiple lead leaves, 120 of them, that are on the machine head. And what will happen is as the machine rotates around you, those leaves will move into various locations. So instead of having just 4 radiation fields or 5 radiation fields, each time the machine stops, it'll give you about 20 different radiation fields. A seed implant is an entirely different process, but meant to accomplish the same goal, radiating the prostate. The difference is that it's done from the inside out. Instead of the machine rotating around you, now we've got the seeds in the middle of the prostate. The seeds are iodine-125 coated in titanium. The titanium makes them inert, so once they're in there, they can stay forever. If you get a new hip, it'll be titanium. With the iodine-125, it decays over time, delivering your radiation basically over 6 months. So what we do, if you're interested in an implant, is an ultrasound volume study. This is in place of the CAT scan. With that, we take slices, only with pictures, from the top of the prostate to the bottom at 5 millimeter increments. We reconstruct the prostate into a 3-dimensional image, and now we'll have size, shape, and also the pelvic anatomy to make sure there's no interference with the needle placement. I'll be able to tell you this right while you're still on the table if everything's a go. Sometimes patients are too large. Sometimes patients have a funny shape. Remember I talked about the prostate being like a fist against a balloon. Sometimes it's like 2 fingers pushing into a balloon, and that can be very tricky to implant. And so sometimes those are just not good implant candidates. Once the volume study is done, we use that information to plan where the needles and seeds will go. When the case is done in the operating room, you'll be asleep, and now we'll use needles that are inserted through the skin between the scrotum and the rectum, and through there directly into the prostate. The only thing that goes through the rectum is the ultrasound unit, and that's just because it's a convenient place to watch from. With the needles inserted into the prostate under ultrasound guidance, we can watch, and as we pull those needles out, we leave the seeds behind. Again, we make adjustments during the case because as I push a needle in, just like it can move on a daily basis during external radiation, it can also move when I push a needle in it. Okay, so we'll accommodate that. Also, after several needle sticks, you can get some swelling and so forth with bleeding within the prostate. We accommodate that during the case as well. Following the case, we wake you up and you'll go home. That's a 1-day treatment option.